Hello, everyone. Welcome to Season 2 of the Sam podcast. We'll be talking about careers this season with me, Mr. Sam. I'm very happy to be back with another episode where we explore important careers that shape our society. Today's career is one many of us visit when we feel sick or worried about our health. We're going to learn about the consulting doctor.
Hello, Mr. Sam. Hello, everyone. I'm Maya, and I think consulting doctors are the first heroes we meet when something feels wrong with our bodies.
That's a great way to describe them.
They listen to us, ask questions, and try to understand what's happening.
Exactly. Let's start simple, Maya. What is a consulting doctor?
A consulting doctor is a medical professional who examines patients, gives advice, diagnoses illnesses, and recommends treatment.
So they are usually the first doctor you see.
Yes, before any specialist.
Some people think consulting doctors only give basic medicine.
That's a big misunderstanding.
Why is that wrong?
Because consulting doctors handle many types of health problems and decide if patients need special treatment.
So they're like health detectives.
Exactly.
Let's argue a little. Some people say consulting doctors are less important than specialist doctors.
I disagree strongly.
Why?
Because without consulting doctors, specialists wouldn't know which patients need their help.
That makes sense.
They guide patients in the right direction.
So they're like the gatekeepers of healthcare.
Yes.
Let's talk about education. How does someone become a consulting doctor?
First, they study medicine at university for many years.
Usually around 6 years or more.
Then they do internships and practical training in hospitals.
So it's a long journey.
Very long and difficult.
What do they study?
Anatomy, diseases, medical ethics, patient care, and treatments.
That's a lot of knowledge.
Yes, they must understand the whole human body.
Let's imagine a normal day in a consulting clinic.
Okay.
Clinic door opens, soft chatter, typing sounds, footsteps.
Patients arrive early in the morning.
Some with fever,
Some with coughs.
some with stomach pain.
Yes, many different problems.
What does the consulting doctor do first?
They greet the patient and listen carefully.
Listening is important.
Very important.
Then they ask questions.
About symptoms, lifestyle, and medical history.
Then they examine the patient.
Yes, checking temperature, heartbeat, breathing, and more.
After that, they make a diagnosis.
And suggest treatment or tests.
Let's argue again. Some people think consulting doctors rush patients too fast.
Sometimes clinics are busy, but good doctors always try to listen properly.
So it depends on the doctor.
Yes.
What skills does a consulting doctor need?
Good communication, medical knowledge, patience, and problem solving.
Why problem solving?
Because symptoms can be confusing.
Like a puzzle.
Exactly.
Let's talk about challenges. What's the hardest part of being a consulting doctor?
Long hours, many patients, and making important decisions.
Decisions that affect people's lives.
Yes, that's a lot of pressure.
How do they deal with stress?
By staying calm, focusing, and trusting their training.
Some doctors work late nights.
And weekends, too.
Hospitals never close.
Exactly.
Let's talk about money. Some people think doctors become doctors only because of high salary.
I don't agree.
Why?
Because the training is long and difficult. If it was only about money, many would quit.
So passion is important.
Very important.
Why do most people choose to become consulting doctors?
To help people, save lives, and improve health.
That's admirable.
Yes.
What kind of patients do consulting doctors see?
All ages, children, adults, and elderly.
So they need to know many health conditions.
Exactly.
Let's imagine an emergency.
Okay.
Urgent footsteps, quick breathing sounds, phone ringing. A patient suddenly faints.
The consulting doctor quickly checks pulse and breathing.
They may give emergency care.
And call specialists if needed.
So they must act fast.
Very fast.
Let's argue again. Some people think consulting doctors don't do serious work.
That's very wrong.
Why?
Because they diagnose serious diseases like infections, heart problems, and diabetes.
So they are very important.
Extremely important.
What personal qualities make a great consulting doctor?
Kindness, honesty, responsibility, and curiosity.
Curiosity again.
Yes, because medicine keeps changing.
So they keep learning.
All their lives.
Would you like to be a consulting doctor?
I admire them, but I'm not sure I can handle blood and pressure.
Same here.
But I respect them a lot.
Me too.
They sacrifice a lot of personal time.
For their patients.
Yes,
Let's talk about trust. Do patients trust consulting doctors?
very much.
Why?
Because they share personal health problems.
That requires confidence.
Yes, doctors must keep patient information private.
That's part of ethics.
Exactly.
Let's argue one more point. Some people prefer to search health problems on the internet instead of visiting doctors.
That's dangerous.
Why?
Because the internet can be wrong.
And scary.
Very scary.
So consulting doctors give real professional advice.
Yes, based on knowledge and experience.
That's much safer.
Absolutely.
What do consulting doctors do besides treating patients?
They keep medical records, attend training, and learn new treatments.
So paperwork too.
Lots of paperwork.
Doctors aren't just in clinics.
True.
They may also teach medical students.
Yes, passing knowledge forward.
That's great.
Very important for the future.
Let's summarize today's discussion. Consulting doctors are medical professionals who
Examine patients and diagnose illnesses.
they study for many years,
And train in hospitals.
they listen carefully and solve health problems.
And guide patients to specialists if needed.
They work long hours.
And handle stressful situations.
They need knowledge, patience, and compassion.
And a strong desire to help people.
Another inspiring career we've learned about today.
Yes, consulting doctors truly make a difference.
Thank you, Maya, for joining me.
Thank you. I enjoyed this discussion.
And thank you, listeners, for tuning in to another episode of Season 2 of the SAM podcast.
We hope you learned something new today.
Join us next time as we explore another exciting career.